50,000 Americans have ALS, also known as Lou Gehrig's disease. It's a fatal neurodegenerative disease that takes away the ability to walk, talk, and eventually to even breathe. As News Channel 5's Roxanne Stein explains, a revolutionary trial is underway to test a new kind of treatment for ALS using human stem cells.
I can't do nothing. I'm just not made that way.
55-year-old Tom Elliott is not a quitter. He has ALS. He fights to keep up with the daily routines of his life, even as the disease makes everything harder.
Brushing the teeth has become a real chore. Turning and rolling in bed to get comfortable has become an impossibility. This disease is about having to give up and sacrifice a lot.
As ALS progresses, it destroys the nerve cells in the brain and spinal cord that control muscle movement until
they cease to be able to move. They become essentially locked in their bodies.
Dr. Nicholas Bullis and his team at Emory University helped develop an experimental approach to treating ALS, implanting stem cells called human neuroprogenitors directly into the spinal cord.
We want to put those cells right next to those dying motor neurons in the hopes that those cells will provide protection and restoration of function. Keep those cells alive, make them stronger.
It's the first ever U.S. clinical trial of its kind.
I'm optimistic that we can do this safely. I'm optimistic that we'll have opened the door to a world of opportunities.
This is my pride and joy right here.
Tom is one of the first to have stem cells injected into his spinal cord, a procedure with high risk and no promises. Doctors say the stem cells won't generate new neurons, but may help protect the still functioning motor neurons and slow the progression of the disease.
Maybe the near or far future, we will be able to manage the disease better and then perhaps one day cure it.
Meanwhile, Tom will keep fighting as long as he can. Roxanne Stein, WPTV, News Channel 5.